The United Nations has released a flagship report. This is the 2023 Global AIDS Update, which makes it clear that there is a path to ending AIDS and has outlined how. To tell us about this encouraging news is Eva Kiwango, the UNAIDS SA Country Director. Eva, good evening to you and welcome. You know, when you see eradicating AIDS, we thought it's a term we're not using anymore. So I thought it was important for us to begin with HIV and AIDS definitionally, that left untreated HIV progresses to acquired immune deficiency, and the death then comes from opportunistic infections. Why are people still dying from this?
Good evening, Imani, and good evening to your viewers. Yes, that's correct. HIV is not what kills people. It's the AIDS when it gets fully develops to AIDS. So it's very important. You can live a very long life with HIV as long as you take your treatment and you live a healthy lifestyle. It's once you get the acquired immunodeficiency syndrome, AIDS, that's when you still can live a long time on the correct treatment, but it's AIDS-related diseases that lead to death, and it's not actually AIDS; it's AIDS-related diseases.
So we'll circle back to what's possible and what is achievable. But a lot of money, that was meant to tackle HIV was diverted to deal with COVID-19. Our health minister in South Africa, for example, said that it reversed our treatment project by about 12 years. 12 years of progress had been lost in diverting money to dealing with COVID-19, particularly through deaths via TB. How do we begin to put South Africa back on track?
So that's correct, Imani. The impact of COVID on HIV was felt around the world, impacting progress against the HIV pandemic and putting millions of lives at risk. We saw declines in health services and a decline in the growth of our treatment program, as you've mentioned. And millions of children are kept out of school due to closures. We saw spikes in teenage pregnancies and escalation of gender-based violence, which have all driven up the risk of acquiring HIV among young women. So these the COVID-19 pandemic impacts were far-reaching. However, countries mobilized the expertise and experience, particularly including South Africa, and decades-long experience to the HIV pandemic to address the challenges posed by COVID. The crisis demonstrated our ability, including South Africa's ability, to mobilize resources and shift policies very, very quickly in the face of extraordinary adversity. So the innovation and the leadership that was galvanized during the COVID-19 experience has being used and underscores the importance of addressing pandemics, continuing to address pandemics, including the HIV pandemic. It has not ended, but it also underscores the pivotal role that communities can play in preserving services access and reaching the most vulnerable and marginalized populations.
Eva, for many families in South Africa, affirmed as the epicenter of the HIV/AIDS pandemic, again, last month by our health minister, this will be encouraging news. The path to end AIDS revelations will certainly fill them with some hope. Share some of these revelations with us.
So the new Global AIDS Update report that was released today shows that there is a path that ends AIDS. We're not out of danger, but there is a path towards ending AIDS, and we have our target of 2030. The data in this report and the real world examples make it very clear what that path is. And it's not a mystery. It is a political and financial choice. HIV responses succeed when they're anchored in strong political leadership. And what does that actually mean? It means that we follow the data, the science and the evidence. We tackle the inequalities that hold back progress. We enable communities and civil society organizations in their vital role in the response. And we also ensure sufficient and sustainable funding. And, if you look across these things I've mentioned, where South Africa is concerned, you can put a tick next to most of these things. And countries and leaders who are already following the path that is mentioned in the report are already achieving extraordinary results.
But we still have the largest number of people living with HIV. We've got alarming and concerning new infections every year, reticent behavioral change, as we heard at the conference recently. Well, where are we missing the mark?
That's right, Iman. South Africa is the country with the largest burden of HIV disease. However, South Africa has made substantial progress. Despite the substantial progress, there's still a long way to go. We need the AIDS response to accelerate. We need to expand treatment for all people living with HIV in South Africa. There are around 2.5 million people who are not yet on treatment. And the treatment gap is particularly stark among children. It's quite humbling and it's quite sad that we're leaving children behind. We urgently need to eliminate vertical transmission from parents to their children, which is happening during pregnancy, during birth, as well as breastfeeding. We need to ensure affordable and equitable access to new HIV technologies, whether they're, pre-exposure prophylaxis in the form of a ring, a vaginal ring, or the new injectables. We need to ensure greater equity and access to those. And we need to focus on ending inequalities that deprive people of equal access to health services and put them at increased risk. And these inequalities include poverty and unemployment, gender-based violence, and the need to keep girls in secondary school. So those are some of the things that we need to do. We need to also expand health services so that we're reaching key populations that are at risk, including sex workers, men who have sex with men, and transgender people, and people who inject drugs, as well as prisoners, as well as the need to make sure that we continue to put communities at the center so that they can deliver and design the solutions. They know what needs to be done.
Yeah. Very quickly before we end, you've said there's a very clear protocol that affirms the purpose, that there is a path to end AIDS. It has to be anchored in political leadership. There has to be political and financial, decision-making, decisions made. When you think of South Africa, do you see that commitment being made? Is our country open to some of these wisdoms, some of these findings that have been outlined in this report?
South Africa continues to be a beacon, Iman, for the HIV response. This is where the struggle was fought to make sure that there was access to treatment, and it continues to be a beacon in the region. We are seeing very clear evidence of the grounding of the response in evidence, in the data. So that's very clear. It's guiding our response to our prevention response, as well as the scaling up of treatment, ensuring that 95% of people living with HIV know their status, 95% are on treatment, and 95% are virally suppressed. Where there's clear evidence of political commitment to finance the response. South Africa finances about 69% of the response from domestic resources, one of the few countries in the world that does that. There's clear, demonstrable evidence of the tackling inequalities, and we hear that every day, as well as putting communities at the center. Very strong civil society response in this country.
Well, thank you very much for your time this evening, Eva. We appreciate it.